You ready?
Mm-hmm.
Okay. I'm Cheryl Keller, and I'm Al's wife, and we've been married 28 years, and for most of those years he's snored. And then I'd say like maybe for the last 10 years or so, he'd have periods where he would quit breathing, and there were times he would like gasp for air, and I would shake him and let him know that he quit breathing, and he'd startle awake and then start breathing again and go back to sleep. And so we looked into it a few years, probably like 8, 9, 10 years ago, about 8 years ago, and found that he had a blockage in his nose, like a deviated septum, and he had surgery for that. And that after the surgery, the doctors, kind of figured he was fixed and never had a follow-up sleep study. And he did breathe better, and he talked about how he could breathe better. But still at night, he was still snoring. He would still quit breathing. And that, kind of went on for another number of years, and he decided to go back for another sleep study when, it gotten to the point where he was falling asleep at work, especially in the afternoons while he was trying to, read his tech manuals or, program, and granted it's a test job, but he would find himself falling asleep, and that would be embarrassing. And he was, crabby when he came home from work and falling asleep, 7:30, 8 o'clock on the sofa every evening, and again, still snoring, and he would quit breathing. And so he decided to talk to the doctor, and the doctor sent him for another sleep study, and then through that found out that he had severe sleep apnea, and they wanted to take him back for a follow-up and fit him for a CPAP. But every single person I'd ever talked to that had ever gotten a CPAP didn't like them. They found if they traveled outside the country and the electricity was different, how do you use that when you're out of the country? Or they just found it uncomfortable. They'd fall off in the middle of the night. Spouses thought they were noisy. Doesn't work well with a marital relationship. It's kind of like this elephant man kind of thing, and they are noisy. And so I had just never ever heard anything good about a CPAP. Never met anyone that liked it and thought it was this great thing. And I heard that there were alternatives, even though they initially weren't willing to talk to him about those at the sleep study place. And so he and I had talked about looking at alternatives, and we did some research on the internet and found that there are some dental devices that will work in that. So he when he went back for the sleep PAP fitting and study that night, and he wore it that night, and absolutely it was completely uncomfortable. He said he woke up at 3 o'clock in the morning, could not go back to sleep. He felt it was worse than not having anything on at all. And then he talked to those at the sleep study program, and someone there gave him Dr. Parmar's phone number and told him to give her a call. And he has been coming here for about 6 months now, and he's got his device, and he's been wearing it about 5 months, and he's completely quit snoring. He doesn't snore at all. He doesn't quit breathing in its sleep. He falls asleep at night. The only time he'll ever get up is if he has to go to the bathroom, which is normal, and he's sleeping better. He's not quite as crabby, and when he wears the device,